Hey everyone, it's Dr. Ty with East Valley Chiropractic. Today we're going to go over a little bit of extremity adjusting. Some of you may have experienced this or why we adjust the extremities. So oftentimes when someone comes in with a low back complaint or a complaint within their hips, there's also associated knees, ankles, and lower extremity complaints that come along with that. And the big kind of example that we use when we're sitting down and going over x-rays is if the hips are off. We kind of compare that to like the balance on your car, where if the balance is off on the car, the tread will wear unevenly on those tires. You can kind of think of the hips being the balance of the car, and then the knees and the ankles can be the tread or the tires, so to say. And so if the hips are off, that can cause unequal stress throughout those joints on the lower extremity as you go down that chain. And so one very common adjustment that we'll do is, aside from adjusting the hips and the low back to clear out more mobility and flexibility within the lower extremities, is what's called a long axis distraction. So that's going to achieve movement and mobility in the femoral acetabular joint, so that's where your femur connects to your hip, and then the knee joint and the ankle. And so essentially what we do is we get down here and we grab onto the ankle just like this, and then we make a quick pull down this way. And you can imagine what that does is that distracts everything, allows those joints to kind of reset and regain that flexibility and that mobility. That's going to help with the ankles, the knees, and like I said, that femoral acetabular joint. That's going to help improve mobility, flexibility while you're walking, running, working out, and just help improve comfortability. And so if you have any questions, obviously just let us know.